our radio partners and our radio broadcast. We have a wonderful show packed with information for you today from the community update side of what we've been doing. We've been here for 9 years as a city council person and as a state representative, now as mayor, to provide you with information to make sure that you have the most empowered position here. We had a great week this week, but before we get to there, we always want to make sure that we thank our Lord and Savior for being with us, and we always want to wrap our arms around those who have lost loved ones over the past week and those that stand in need of prayer. And Dr. Reynolds, I know I was supposed to give the prayer this morning, but you are always cued and ready for a great prayer, and if you don't mind, if you give the prayer this morning.
Yes, sir. Well, shall we bow our heads? Heavenly Father, we thank you for another day. Lord, we thank you for taking us through trials and tribulations and losses, and we ask you to comfort those who are experiencing the pain and injury of COVID, the losses of COVID. Lord, we ask you to comfort those families and those children and those loved ones. We also ask you to guide our actions, our deeds, our thoughts, so that we do not turn to violence and words of anger, that we turn to words of peace. We ask you to continue to guide and direct our mayor and our local leaders, our state and national leaders, so that they may see the things that they must know. These things we pray in Jesus' name. Amen.
Amen. Amen. As I once stated, we have a great we had a great week this week for the city of Flint as it relates to all the movement and the forward progression that we've made as a city. Transformational is the word we're going to use today, but we have to make sure that we save and preserve lives in our community, and we still have that deadly virus, COVID-19, and many different variants. We have Dr. Furholden with us, who's been with us over a year, making sure that we have the best science, and also Dr. Reynolds is with us, making sure we had the best medical advice to make sure we save lives. Now, through the city of Flint and also a little bit of Genesee County and also different parts of our nation, we've seen more cases, and we're going in a difficult direction right now. And so I'm going to turn it over to Dr. Furholden for a little bit of an update about the numbers and where we are moving as a community.
All right, great. Thanks, Mayor Neely. This is interesting. I haven't been in person with you in 18 months or more.
Right.
And then to not have a mask on, I forgot you had lips and everything on the face.
Yeah, I do have a half of a face here.
More than half of a face.
Right.
We're doing really great on COVID. It's important to acknowledge all of the tremendous work that we did and how truly your administration listened to public health. We had a little uptick in Flint last week, and I always give people the caution about statistics. So 2 weeks prior, we had 2 cases in the city of Flint. The following week, we had 8. That's technically a 400% increase. That big jump was attributable primarily to one household. We had an outbreak in a household.
Wow.
So you got to imagine, if you're in my house, there's 5 people in my house now, 4 people in my house now, and one little one to be. If all 4 of us got COVID, it would really throw the numbers up. So we do this health equity brief every week in partnership with the city, in partnership with the health department, because we want to give people context, but we also want to give them the numbers. So we went from 2 to 8, and now we're back down to 3.
Okay.
So our numbers are really, really low. People have heard a lot about this Delta variant. They've said we haven't detected any Delta cases in Flint. But I do want to caution people, it doesn't mean that we don't have any here yet. What it means is this: every week, people get tested for COVID. 10% of those positive tests get sent on to the state. The state then takes a random sample of 10% of all the samples that they get, and they try to do what's called genetic sequencing or genotyping, so we can understand specifically what strains of COVID we have in our community. So we haven't detected any in Flint yet, but it doesn't mean that there might not be a case or 2 here. What we do know about Delta is that it spreads a lot more easily and that people tend to get sicker. The vaccine is still effective against Delta, but it doesn't seem to have that 95, 96% effectiveness that it did with the original strain of COVID.
Right.
So my encouragement for people is when you're out in large gatherings, mask up, get vaccinated. If people have said, I'm over the mask, at a minimum, get vaccinated. The vaccine is designed to, 1, prevent people from contracting COVID in the first place. And it looks like it's pretty good at that, 95, 96%. For the variants, we'll know exactly what that number is, but it's still pretty good. What it's also really good at is preventing people from getting sick and preventing people from dying. So our numbers are going down substantially. We've almost flatlined on COVID cases in the city. The other area is vaccinations. Unfortunately, our rates of vaccination are creeping along at a snail's pace.
Right.
What we did this week in our health equity brief is we said we're going to break it down even further. And what you'll notice is most of the people who've been vaccinated, we heard this number, we wanted to get to 70% by July 1. We did that, but only in the older population. So in the 60 and over population, more than 70% of them are vaccinated. Where we're still struggling is in younger populations, that under 60, that under 55. And I don't know if it's because people have this myth that they're somehow immune, that even if they get sick, they'll be okay. It's just not worth the risk. We have a good tool to prevent people from contracting the virus and getting sick. We need to use it. So my encouragement for everybody, if we want to stay where we are, if we want to keep this thing under control, be that source of encouragement for the younger folks to get their vaccine.
Right, and as we see more churches are opening their doors for in-person worship, we have to make sure we understand that we're not all the way through this. This is still amongst us. It's a new variant, a Delta variant. And so, Dr. Reynolds, I'm going to ask you the question about, now we knew with the original COVID virus that there were certain symptoms, a high temperature, runny nose, and different things, a cough. We knew some things that could have been primarily symptomatic for the original COVID virus. Is there any different symptoms for the Delta variants?
No real significant difference. You may see more diarrhea. You may see more vomiting. But this variant is just more contagious. And so that means more people will get infected. And because more people get infected, the chances of more people getting severe cases and hospitalization go up because it's so easily spread. And that's why the first step is prevention, as Dr. Furholden has said, vaccination. We don't know how well the vaccine works in the variants, but we do know it's better than nothing. And I'm talking about in the 80% right now versus 95% for the original COVID-19 virus. So remember, vaccination is the first step. And as Dr. Furholden has said indirectly, but I'll say directly, there are layers of protection. And so masking up in a crowd, having people who you know are not vaccinated come into your household, especially if you have immunocompromised members in your household, someone who had an organ transplant, someone who's getting cancer treatment, someone who has any immune problem, make sure your guests mask up.
Right.
That's to protect those people and your children. Because I just want to add, Mayor, school is coming soon. And if you can get your vaccine next week and the second vaccine in the third or fourth week for your children 12 and up, you give them a layer of protection that is essential. And then we have to have a supply of masks for our children 12 and under if we want our children to get back to school.
Right, and anyone can come to City Hall. City Hall is reactivated now for 7 different departments, but our front desk where our health navigators are located is open. If you need masks, if you need and you don't have masks for your children that's 12 and under, or even if you have not been vaccinated and you're still contemplating of being vaccinated, you can come to City Hall. We will provide you with a mask. Now, I know it's very distracting because there's a lot of different mixed messaging out there and there's a lot of confusion in the air. And so pay attention to the life-saving information that we're providing. That is what this municipality has been focused on, and we're not apologetic for it. We will continue to save lives and provide a level of quality of life for residents, absence all the other noise, but pay attention to how you can help protect yourself and your family. Now, as we move on into our show, we have Luke Zelli, the Director of Disability Networks inside the City of Flint. And Disability Network provides a level of service for those with disabilities. But one of the things that people don't understand is that many of us in the community, including myself, has a disability. Diabetes is a disability, a qualified disability. Asthma is a qualified disability. And these are some of the things that COVID-19 has taken advantage of, people with these type of small disabilities. And so Luke Zelli has an announcement and also a level of request for you, the residents, to partner with the Disability Network so we can help empower our community in total. Luke, good morning. Mr. Zelli, are you there, or you're mute?
Yes, good morning, Mayor.
Yep. Great. And want to talk about the disability. Talk a little bit about what you're doing and how people can help and be a part of the Disability Network and or understanding our disabilities and how we can make sure that we taking care of our family members and our neighbors.
And first, these conversations are so critical for the community, just being transparent and understanding and having information available. And on this pandemic, I really think it's forced our community to rethink disabilities. We typically think of folks who are in wheelchairs or people who are blind or people who are deaf, which is true. They do have disabilities, but this pandemic, you're right, we are talking about people with asthma, people with diabetes, heart conditions. These are all populations that are at high risk, and they really do need to get information. And this Friday we're going to be celebrating the 31st anniversary of the Americans with Disabilities Act. We're going to have a mobile vaccine center. It's at Powers High School from 11 to 2. So if you're out there in the community, you want information on vaccines, you want to know how it impacts folks with allergies, folks with cancer, people who've had transplants, I encourage you to stop by between 11 and 2 to get information on those vaccines. So, I know you're asking about what is the Disability Network doing right now? How can we partner? What's needed in the community? And I think as we're rethinking disability, we are looking at moving out of our building that we've been in for 20 years into a new building where we can really educate folks on things like the vaccine, where we can help them understand how do you get accommodations in the workplace if you are recovering from cancer or you are immunocompromised. How do you go back to work safely? And the same thing with businesses. How do you make that workplace accessible? So there's a lot of resources that are available. We've had great partnership with organizations like MTA, the Mott Foundation, and the city now, looking to help us put in some new resources for folks that we can respond to this pandemic.
Right. And the thing about it is that, you came in earlier this week to have a conversation about partnership level with the city of Flint about making sure that the new facility where you can accommodate more residents in the city of Flint, where we can partner with you and help you with that. And I think we made two wonderful connections. We made a commitment making sure that we will be able to assist people with disabilities in the city of Flint and the surrounding areas, but also ramps. We talked about people that it's in need of ramps, recent stroke victims or different things of that nature, and there's a level of ability for some dollars to be removed from the city's line items to be able to go to help families with that needs wheelchair ramps and other things like that. Could you speak a little bit more about that?
Yeah, I think especially during this pandemic, you think of folks going into nursing homes, people that need to get out of hospitals, and a barrier for many folks is getting back into their home, having an accessible ramp put in. We've got some great partners, United Way, you've got Habitat for Humanity, but these permanent ramps sometimes take up to 2 months to build, and when folks need to get out, they've had a stroke, they need to get out of the hospital, they need to get back to their home. We've got some limited temporary ramps where we could put those out within 24 hours so that folks can get back into their home, recover safely. And we've asked the community, we've asked the city of Flint for support in expanding and making those temporary ramps more available. The last thing we want, and nobody wants to go into a nursing home. I mean, people want to recover in the community. They want to recover with their family. And so these temp ramps, with your support and the community support, we're hoping to get those out available in the community quickly.
Yes, and one thing about it is that this administration understands the need for people to be able to have a certain level of quality of life. And one thing about it is that it doesn't take me long to engage in a partnership where it's going to benefit the people. And we're going to continue to make sure that we have a long-standing commitment to the Disability Network, which was ran by your father prior to you, Mr. Mike Zelli, which is a good friend of mine. He and I served on the MTA board together for many years, and giving him all my best. And we're going to continue to make sure that families with disabilities or some needs will be met through the partnerships that we have. And Luke, can you give us a number where they can reach you at Disability Network where people may need to get more information? Is there a number?
Yeah, and I would say August 1st we are reopening to the public, but the best way to reach us right now is by phone. It's 810-742-1800. And Mayor, you have been supportive of the disability community in Flint for years, and the things that are really important, accessible voting. You and your clerk have done an amazing job of making sure machines are available for folks that are accessible, that facilities are accessible, that people are trained on disability awareness. And it even goes into law enforcement. Like all of the cadets, the police that are graduating, they get trained on mental health first aid. And I'm so proud of our community for passing the millage that allows for mental health training for police, resources for students with disabilities in school. So yeah, you've had great leadership and support for years of the disability community. We appreciate that.
Well, you're welcome. We had a great week in the city of Flint this past week. We had a couple visits from some of our state officials. Our governor, Gretchen Whitmer, came to town to make a great announcement through our level of partnership and working with the government, our state government, and also our federal government. Also, our Secretary of State, Jocelyn Benson, made it to town to visit our one Secretary of State's office and also the one that's right in the Out County area. But first, the great announcement that we had to announce here in the city of Flint. The state of Michigan has 83 counties throughout the state of Michigan. 82 of those counties have state parks, 82. The only county that was without a state park was Genesee County. But through the efforts of hard work, partnership, and making sure that we do the right things and staying focused, Genesee County will have its first state park, and that state park will be located in the city of Flint. Yes, congratulations, city of Flint. We have a state park, and this is going to be one of the best, if not the best, state park in the state of Michigan, right along our river. It will be taking a contiguous a land space that was needed some remediation for contaminants, and also repurpose this property. The old Chevy in the Hole is being now repurposed for a state park right here in the city of Flint. We knew that Chevrolet had a manufacturing facility on this location for many years due to the downsizing and relocation of many of the General Motors jobs and facilities. That place became just a contiguous piece of land between Kettering University and our downtown area, and it's beautiful. It's walking trails there now. It's other beautification models there now. Please go there and take a walk through there and just take a look. But that's going to be the site of our new state park here in the city of Flint in Genesee County. And our governor came with Congressman Dan Kildee, other state representative John Cherry, state representative Cynthia Neely, and others, county commissioners Brian Nolden, Mark Young, Dominique Clemens, Ellen Ellenberg. We were all there, and it took a level of partnership and focus. And that's one of the things I talk about in this community. We have so much if we come together around a level of positivity and thinking and vision. Now $26 million has been allocated from the state of Michigan to be able to make this vision happen with the state park right here in the midst of our city. And so that's great news. Also, the groundbreaking, thank you, Genesee County and Genesee Health Systems, whereby our families can be able to get the mental health support they need for children right downtown Flint, where previously it was a strip club there and some other pieces. Now that space is going to be used for the new building. If you're driving down Saginaw Street going north, if you look directly over to your west, you'll see the new construction moving forward for our new Genesee Health Systems for children and families to be able to help provide them the level of support that they need. These are moving models. This is transformational, and when we work together, we can get there faster. And so we will continue to move down this path of making sure that we have this wholesome community in which we're working toward, but we get there faster if we're encouraging one another and not working on divisive type of movements. And so I want to just talk about that. But also, water. Water, I believe water is a human right. This mayor has not cut anyone's water off through the lack of payment since I've been in office almost 2 years now. And so we will continue to understand that water is a human right. But people, we have to participate in paying our water bills. As we looking at a flat rate system where we can get to a one cost for our water, trying to reduce our costs, we're making the modifications and the upgrades that's necessary. And so on the line with us is Amanda Truhill, which is our city treasurer, which is empowered with the level of making sure our water services are continuing and making sure the customers are taken care of. We just recently put into place that no longer will water bills or the water unpaid bills go on your property. That usually happens in the foreclosure process where water liens are placed on your property along with your taxes, and then you lose your possession of that property. But no longer will we do that. We will look at other measurements to collect those unpaid water bills, but we will no longer put it on the backs of your property taxes as long as I'm the mayor in the city of Flint. And that's forward progress, and that's faith, and that's through my measurement of faith. And Amanda, can we talk a little bit about some of the programs that we have to help people if they need help paying their water bill? There's a lot of money out there, more than $36 million available to help people with their utility bills as well as their past due rent bills. Amanda, you there?
Yes, I am, sir.
Yep. All right, go ahead.
Okay. Yeah, the main avenue for people to get assistance is through the RAP program. And I don't have the number in front of me, but it's on the back of everyone's water bill. And that is through G-Card. The RAP program, they'll do an intake, see if you're eligible. And what they do is they will, you pay your bill minus $25, and they will pay the other $25. And if you do that for 6 months, then they'll pay $350 towards your bill. You do it for another 6 months, and then they'll pay another $350. So you'll get a total of $1,000 paid towards your water bill. And the other thing is customers can go to also not only to G-Card but also to Catholic Charities to get assistance.
Yeah, let me give those phone numbers out. The state of Michigan, through MISHA, provided $36 million, and a portion of those dollars have went to G-Card for assistance for people that are having trouble paying their water bills, and also to Catholic Charities. And so you can call the number, set up for the assessment and the review. These are just some of the access points to be able to help people get the level of service and assistance when needed. G-Card's number is area code 810-232-2185. And I repeat that number, 810-232-2185. Catholic Charities also participates along with our other two programs, the RAP program, G-Card, but Catholic Charities also has resources available to help people. And that number is 810-232-9950. 810-232-9950. And we will continue to operate a level of information sharing from the city of Flint, because there are multiple programs available to be able to help and assist people with their water bills and past utility bills. And also the federal government will also be forwarding $34 million over to the state of Michigan to be able to help with the water bill and other water bill assistance. Through my conversations with the EPA administrator, Congressman Dan Kildee, and the governor's office, we will make sure that we tap into those dollars right away to be able to make sure we can help people with that. But what we need first for you to do as residents to be able to call in to ask people what programs are available for you to be able to get that level of assistance. And this is where the level of partnership for your local government and your state government comes into play. You should be able to call into your first line of residential government interaction, and that's through your Flint City Council. you can call that office. The number is 766-7418 and ask for your council person. That your council person should be able to tie you into a level of connectivity to some of these entities, the RAP program, G-Card program, Catholic Charities. I understand that role and responsibility because I sat in that seat as a council person for 9 years, making sure that we can provide a level of service and answer and information. Then it gets to the administration for the operational needs for our community, to making sure that we're working toward a program to reduce your water bill and to reduce your water payment obligation. But now, with that said, habitual non-payers. As I asked Amanda, our city treasurer, to go through the system to see who was a habitual non-payer, we will first start a program looking at how to be able to help and provide the information to get the assistance for you to be able to pay your water bill through these other entities and providing a level of help. But then we will go after the commercial non-payers. That means commercial buildings, non-residential, who has refused to pay their water bill. We've seen this in Sunset Village. We've seen this in Richfield Manor, where they owe the city of Flint more than $1 million in past utility bills. They have stopped paying their bills back in 2017. We're in court with them. We're going to be making sure that we recoup the dollars that is owed to this community on the commercial level. Now, non-residential commercial structures that receives the benefit of water that has not been paying their bills, we will start a program to disconnect them from the system until they make good on their water bills. We will do that. And then we'll move on to the non-paying habitual residential folks. And Amanda, I think you ran a query saying that some people haven't paid in over a year, no portions of their bill whatsoever.
That's correct, yes.
Oh, okay. That's she gives it a quick answer. She likes to do that. Do you want to elaborate anything about that? Is it quite a bit of people? And what is that threshold about the dollar amount that is owed?
Yes, I ran the query for someone that hadn't paid in well over a year. I did believe 18 months, and I ran it for anyone over that had $500 or over, but it was more like $2,000 and over, and it was almost 600 accounts.
Right, and so even with that, if you find yourself in need, you should not just not pay or hide. If you come into City Hall, and we'll make arrangements for you to start a level of payments if you do not even qualify for some of the other wraparound services programs that will help you, but we will work with you in the city if you just start to pay. But these are individuals that she just talked about that has not made one payment. And one thing I like to do is say we lead by example. And I ask my staff, my administrative staff, and the employees of the city of Flint to be able to participate in making sure they provide a level of examples as a resident of this community to make sure they pay into their utility bill, elected officials alike. And so leading by example is very important, but we do have wraparound service for families. And as we coming to looking like a close to our radio broadcast, we want to make sure that we encourage people to be able to protect yourself and your family. The COVID virus mutates, and we have the Delta version. What is it now?
The Delta variant.
The Delta variant. That's Dr.
Yeah.
Ferhoden. She's here right so I can look at her and she can help me out. The Delta variant, and we have to make sure we're not through this. So faith leaders, community leaders, make sure that we understand what is, you can't have a quality of life if you have no life. When you lose a loved one, you've lost a loved one. Let's make sure we save lives, and let's make sure that we do the things that's necessary to encourage one another as we go through this journey called life. Our faith, our God dictates us working together. It's in Psalms 133:1, how good and how pleasant it is when brethren dwell together in harmony and unity. And so, Dr. Reynolds, we will be going back to our Facebook Burst program, and Luke will be talking more about the Disability Network and all the great things that we have inside the city of Flint. With this last 30 seconds, I want to say, Mom, I love you. We're going to breakfast today. We're going to go to a lightly inhabited restaurant where we can make sure that we're being cautious and safe. Mask up, wash your hands, maintain your social distances. And I want to thank all of our partners out there of like thinking, making sure that we can move our community forward. So stand by for our Facebook Burst program. God bless you, WFLT. And once again, I love you, Mom.
Thank you for tuning in to the community update.
Okay, guys, stand by for our Facebook Burst program. We're going to have a run just like this, but we from Disability Network, and we have Monda Truhill, our city treasurer, to talk about and provide a level of good information for you, residents inside the city of Flint and other places, if you want to participate and help out the people inside the city of Flint. We are a resilient community. We are the county seat of Genesee County, 32 units of government inside of Genesee County, and we like to say that we're the lighthouse of what happens in Genesee County. So it's very important that we succeed as a community. So first up today, we have Mike Zelli, and I'm sorry, excuse me, Luke. I'm sure people already sometimes mistake you and call you by your father's name, but we have Luke Zelli from Disability Network, the director, talking about some of the things that we need to do to be able to enhance the services for people with disabilities inside of Genesee County and also the city of Flint. Good morning, Luke.
Good morning, Mayor. Thank you for having me.
Absolutely, and we're into our Facebook program, BURS program, and I guess we're on ScreenYard, and we're using a lot of levels of service of multimedia to be able to communicate the messaging. Today I have a lot of technical people around me. Dr. Furholding, being a multi-talented person, is one of them. But talk a little bit about the Disability Network and what we need to do to make a better partner to you and your organization.
Yeah, I would. A couple of things I would start off by saying is that Flint has a rich history of disabilities and great organizations. But in the past 5 years, our community has changed pretty dramatically when you think about the water crisis and the pandemic that we're in. So, typically folks think of disabilities as people who are deaf, people who are blind, people in wheelchairs. But these opportunities in our community is really, we've looked at disability in a different way. It's way more than you think. It's folks with ADHD, anxiety, autism, lupus, migraines. And you think about the pandemic and folks who are in high-risk populations, people with asthma, allergies, cancer patients, heart conditions. This impacts so many more people in our community. So we are looking and partnering with a lot of folks in the community to move from our location of 20 years to a new building with support of the Mott Foundation, MTA, Joe Serra, and the city and the community leaders. Because we've got to be able to have services that are really needed right now in our community. I think about vaccines and the information that's being shared, and a lot of folks may be hesitant. They don't know the impact on folks that are high risk. They may have misinformation about vaccines. And so having trusted community partners and folks that can meet people where they're at, have accessible locations, is really important, especially as we're kind of reopening businesses and folks are going back to school. What are their rights? How to accommodate? And probably one of the biggest things, I think, is just really changing that thinking around disability, what disability is and biases that folks may have. And so this new facility really gives us an opportunity to do lots of training with law enforcement, with school teachers, community leaders, family members, and we're just really excited about that partnership and opportunity.
Right, and I'm going to kick it over to Dr. Reynolds because as a physician for many years, a pediatrician, he understands some of the challenges, especially when you have young people with a level of a disability and making sure that people can provide a level of comfort for those that, and accessibility, I'm trying to get that word, making sure those families have those things. And so Dr. Reynolds, do you have much experience with the Disability Network and some of the things that they provide and the service they provide?
Not direct experience, but we play as physicians and health providers a supporting role. And the key is, number one, have a physician or healthcare provider that you see on a regular basis, because the networks will call for information and they will coordinate their plans with the information that you can allow your health provider to provide to the Disability Network as a partnership. So please have a doctor, be under the care of the doctor, refill your medication, make sure your vaccinations are up to date, and make your regular visits. That's most important because when the time comes for records to be presented, you need to have that information on file.
Right, and Dr. Furholden, we know we talk about that, and you with the Michigan State Extension programs, and you do a lot of different things in that area with but people with disabilities, as Luke just talked about, like he identified me as a person with a disability because I'm a type 2 diabetic, and many people with diabetes, especially on that mild level, don't look at themselves as a person with a disability, but people with asthma. But the COVID-19 virus very much exposed all those levels of disabilities that we have in our community. What do you have to weigh in on this particular conversation?
Well, I think the reason it's important to note that is because there are things that we can do. Kids with asthma have had to suffer in school buildings that didn't have great ventilation. You know, and during COVID, we knew we had to do a better job of air handling and air circulation inside of schools. That's going to benefit kids with asthma. We learned during the Flint water crisis, you know, if you have a diet deficient in calcium, the body will treat lead just like calcium.
Okay.
If you go back to your old chemistry lesson, it's what's called a 4+ cation.
Right.
They both got 4 electrons on that outer shell. So if you don't have enough calcium in your diet, your body will have lead come in and it will more readily uptake lead. And so if people are dealing with nutritional deficits and other things like that, or have other health conditions that impede their ability to sustain their food that they take in, there's all of these things that COVID just sort of elevated our opportunity to, 1, have more empathy, 2, to have better understanding, and 3, to really take the reins of our own health. We do have new opportunities that are available for everybody to have health insurance and health coverage. Hamilton Community Health Network, to me, has been a real champion for the Flint community. It's what's called a federally qualified health center, and they've really stepped forward. They've been doing COVID testing, COVID vaccinations, but before COVID, they've been providing primary and preventive care for our community for a long time. Right. Their doors are always open. They take people who are uninsured and underinsured. You know, we have Medicaid expansion, so now everybody can get health insurance. Affordable care has really become affordable. You could be 3 times the federal poverty level and get insurance for as little as $10 a month now. You know, so I just think it's important that people take advantage of these opportunities and that people have more empathy for people who have disabilities or have pre-existing or chronic health conditions, because we learned during COVID, it's already a tough go of it, but it literally costs people's lives. You know, you are no less valuable to our society because you have type 2 diabetes.
Correct.
You know, so.
Yeah, but I want people to, in the listening audience, to be able to understand that, Dr. Verhoeven went to Flint Northern High School, but because I went to Flint Northern High School, I don't know if she thinks that I know what a 4+ ion is, right? And so I don't know exactly what that is in that particular chemistry class. Maybe I didn't get to the wing of the high school, but 4+ point ion, is that what you called it?
4+ cation. It's got 4.
Okay.
The molecules interact based on the electrons on the outside, and they have the same number of electrons on the outside, lead and calcium.
Well, don't worry, Luke and Amanda. We won't have a test on that later. But definitely, it's good information for us to understand about the benefits. And Luke, can you give them the phone number to the Disability Network so people can actually come in and actually talk to you guys or reach out to you, especially for the disability ramps, temporary ramps that you guys also put. What is the access point for your organization?
Yeah, I'll give this number a couple of times. It's 810-742-1800. And, the Disability Network, we're a 30-year nonprofit advocacy organization here in Flint, run by, for, and with people with disabilities. And so it's really navigating all of the community resources, whether it's housing, employment, transportation, accommodations in school. We're kind of a first stop for folks with disabilities. And I think 60% of the population in Genesee County are folks with underlying health conditions and chronic disabilities. And so it's way more than you think. So if you have a disability, you have a family member with a disability, you want more information about vaccines, primary care doctors are a great resource. Trusted nonprofits, faith-based organizations are too. And our number again is 810-742-1800. And the last thing I would say is this Friday that's coming up, we're celebrating the 31st anniversary of the Americans with Disabilities Act. There's a celebration over at Powers High School, and Genesee Health System will have a mobile vaccine unit there. If you're curious and you want more information, it's a great, safe, trusted place to come.
Right, and I want to thank you on behalf of the residents of the city of Flint as mayor for the great work that you're doing. I'm just hopeful and prayerful that as we put out this information, that people understand that they can access help, the help that they need. One thing about it is here in Genesee County and also the state of Michigan, and also being a part of a United States citizens, many people in communities of color or low to moderate income areas, they don't access all the availabilities for the programs that's out there. One tool that we will do, and what I've been doing for the last 9 years on this community update broadcast, is trying to put people in contact with the organization, those structures that can actually support their needs and also provide them a level of help and assistance. We don't have to have, Uncle Joe try to build that ramp with a piece of plywood and something that's unstable. We have professional organizations that will come in to help assist when you have to be able to do those things. There are dollars available, and there is a bouquet of services that's available to residents. And one thing about when you're a true elected official, you're supposed to be a concierge for the public, a place where you can come and access the information that you need, and working together in partnership with other entities to be able to give people the services that they need to improve the quality of life for them and their families. And so with that, we talk about the aspect of water. Water in the last 7 years in the city of Flint has been very troubled and problematic as it relates to a crisis in confidence and understanding where we are. There have been more than $1 billion of resources. Well, let's go this way. It's been more than $2 billion allocated in resources to correcting the problem of water infrastructure and other things in our community. But many people are not feeling that help. We're starting to get to that direction. We're moving in a great positive direction. We're building the secondary water delivery system. We're going to be here next week with the EGLE, that's the Environmental Protection Agency in the state of Michigan. Will be here looking at our new construction, how we're moving forward, improving the quality of the water, and trying to restore a level of confidence, trying to reduce water bill and water costs. We've been working toward that. Don't get distracted by the noise. Do not get distracted by the noise or the naysayers. And so we're going to continue to move forward together as a unified mind in a positive direction. We will continue that course. We will stay laser focused, and we will stay committed to making sure we work with our partners. One of those partners internally is a longtime employee, Amanda Trujillo, inside the city of Flint, working toward. And I tell you, when we came in with our vision, with the vision of saying water is a human right, we had to really work around the system because we are not a very rich city. Matter of fact, we're not a rich city at all. And so when I said that I didn't want to have a disconnection of anybody through the loss of water services, especially through the pandemic. Thank you, Dr. Reynolds, for coming in and bringing that awareness to us. And then we saw others, even the state of Michigan took our lead in doing so. We're still on that trajectory, but we need your help as people in the community that deserves this commodity. But we all have to put in our fair share. We need you to start paying into the system if you're having trouble. There are other entities out there that will assist you. G-Card is one that will help you pay your water or your utility bill. You can reach them at 232-2185. Catholic Charities, you can reach them at 232-9950. And also from the state of, by way of the federal government through the state of Michigan, we're looking at ways that we can reduce your water costs for you, the residents. I am committed to making sure that we will continue to work toward that effort, and I will find a pathway, but I need your help. Habitual non-payers. We have more than 600 people in our system that's using water that has not paid in over a year. We need, if you're having difficulties, you can call Catholic Charities or G-Card or our RAP program, or you can come in and start to make arrangements. We will not put these things on your property taxes, but we definitely need your partnership. If we're moving in good faith as a community, as a municipality, we need your help as well. Now, for those commercial entities that's generating revenue and through their business and their services and not paying their bill, you won't have to worry about services much longer. We are now tracking down who are the most notorious habitual non-water payers in the commercial area, and we're making remedies through our law department and also our utility department to make sure that you will not ride the backs of the residents of the city of Flint. Amanda, did you want any part of that? I usually took up a little few of your words because I know you like the short answers.
No, I think you covered everything. Like I said, I just encourage people, to come in, talk about the water bill, talk about conserving water, because a lot of people, they might have their internal infrastructure, they might have leaks, things like that. I mean, that's something that I also would like for the city of Flint to help residents with.
Right. And with that, as we wind down, our Facebook Burst program is, going to go a little bit shorter today, but as it winds down, we're going to, next week's show, we're going to be talking about crime prevention, and some other measurements that we're using. The President of the United States, President Joe Biden, has recognized the level of the uptick in violence throughout our country. If you watch the news, if you watch world news, you see the level of uptick. Even in our Michigan areas, you see Saginaw that has a 200% increase. Grand Rapids, Kent County, a 300% increase in very serious violence. We have about a 30% increase here in the city of Flint, but we're working toward it. But remember, the people who are committing crimes in our community are more likely sometimes as our neighbors, our friends, our family members. And so we all have a responsibility to be able to talk to them. Even on the lower end of when we talk about blight, people dumping in our community, treating us like a garbage can, we can't afford for them to do that. That's why we enlisted the services of Crime Stoppers and became a partner with them over a year ago. If you see something, say something. And Dr. Verhoeven says, you're not snitching if you're not involved.
Yeah,
right?
you can't be a snitch. The definition of a snitch is you were in on it.
Right.
And you told on others to save your own behind. If you saving your community and you ain't in on this destruction, you can't, by definition, be a snitch.
Right, and so that whole scenario, a lot of crimes that we're seeing is retaliatory crime, meaning retaliatory crime if a person A is harmed by person B, then person C will come in and try to go after person A. I'm getting mixed up a little bit, but the thing about it is the retaliatory activity has been going on inside the city of Flint. People speeding up and down streets, but then we have to be focused about when we go after them. When we go take a hard line against them, we don't have to tell our law enforcement officers that we want to defund them. When we say we want to take cars of those who are using those as nuisance in our community or drag racing and putting people's lives at risk, when we say we want to take their cars, we can't pause and say we don't want to take their cars. When we say we want to put actions and law enforcement activities forward, we cannot pause and say we want to give them another chance because they're impacting all of us. In the city of Flint, one thing that I've done as a state legislator is that one of the things I stopped people from going through high-speed chases in residential areas because we've seen the byproduct of people and failures and loss of life as a byproduct of that. If you remember Mrs. Nichols, who lost her life because of a high-speed chase, and others in this community. So one thing when we see these cars are souped up cars and they're racing and burning rubber in the road, and when law enforcement engages them, they're more likely to flee at a very high rate of speed. But our choice is not to be able to put other civilians in harm's way. So when we talk about the commission of leasing, not buying, leasing a helicopter or air support, so therefore I guarantee you any car, no matter how fast it is, will not outrun airborne surveillance type of activity. We will get them. We want to go after those individuals, those offenders of crime. And that's one reason that we were talking about, and our police chief, Terrence Green, was talking about engaging a level of leasing the services of air support. So when we see these activities, these drag racers, we will go get them when they pause. And they will pause at some point in time, but we will know where to go get them without putting civilian lives at risk. And so we have to really talk about these things, and we have to have a high-minded type of legislative thinking as we engage these things to be able to say, how can we reduce these violent crimes in our community? And so how can we engage these nuisance type of crimes? Right now, every law enforcement force everywhere in the nation is looking at a worker shortage. We've seen that in many different places. We have a collision of responsibilities, and we have some things that we have to work through, but we only can do that as we work together. And so with that, I want to also push it back to Dr. Reynolds. And Dr. Reynolds, being the most seasoned individual on this call, and you've seen many things through the course of your life, what do we need to do as a community to be able to say that we're tired of being at the surrendering to the lowest common denominator in many aspects of it. What do you want to say to our listeners?
So I've said it before, and I'll say it again. HALT. HALT. If you are hungry, angry, lonely, and I'll add to that, liquored up, or tired, don't make any life-changing decisions. Learn to listen, reflect before you react. And if you walk into a situation where things are hot and you can't reason with the people there without making threats or threatening harm, pull out. That would be the most important thing we can do, but the key is to listen and guard the words that you use. Don't start off cussing somebody out.
Right. They say high emotion, low logic. And so Luke Zelli, as we're getting ready to wrap this up, we talk about these things. And so overall, what is the overall messaging that you would like to leave our viewers and our listeners with today? You might be on mute again, Luke.
Yes, still here. Luke, I think the message I would share, Flint has had a lot of challenges, but we've always come through as a strong community when we're united. And there is a lot of stress right now. There is a lot of anxiety. So just reaching out, again, to faith-based leaders, there's mental health resources available, contacting the Disability Network. These are ways that we can kind of de-escalate things and making sure that you're putting your health first in the community. But we all have to pull together and partner with our resources to support each other.
Absolutely, and we're going to continue to have a level of partnership with the Disability Network because you do a great service. From the time that your father was there in the position that you now hold, I just love the work that you do, and I want to thank you again for doing that great work. And then moving over to my great friend, Dr. Furholden, who is everywhere all the time through the measurement of technology. We appreciate the work that you've done and continue to do inside the city of Flint. What is your messaging for those that's viewing us via social media?
I just encourage people to stay safe, practice good prevention. The three messages I've been trying to really impress upon people at the beginning of this pandemic, I've heard all kinds of gimmicky things that people can do and should do. And I encourage people to practice three basic things. The first is to eat the best diet that you can afford. Eat a high nutrient-dense diet. Whole foods are best. Things that have labels on them aren't the best. Bag of chips, far inferior to an apple or an orange or even a piece of chicken, a lean piece of chicken. Eat a great diet. Practice good sleep hygiene. Sleep is our body's chance to restore and repair and heal itself. And move your arms and legs every day for at least 30 minutes. You don't have to go to the gym. Walk in your neighborhood. Do whatever you can do. I just encourage people, practice those three things: sleep hygiene, good diet, and move your arms and legs every day. If you do that, you are putting yourself on a much better path for health for the rest of your life.
Right, and Dr. Reynolds, we're going to have to work on the cost of the fruits and nutrients, because a Honeycrisp apple costs way more than a bag of chips. And so we got to figure out ways to make our food choices more affordable for families so we can have the better choices. Now, Amanda, I want you to say more than a few words this time. Tell us about what we can do and how we can connect with our services with the Water Service Division and how we can go through some things. If the biggest complaints that we have, tell people how they can correct those things by contacting with our Water Customer Service Division.
Yes, to all the residents, we are now open. Our office is open 9 a.m. to 5 p.m. Monday through Friday. If you have any questions on your bill, come on in and we will help you with that. And like I said, we have the reasons we can give you, point you in directions of who can help with the bill and also give you tips on how to conserve water.
All right, that's wonderful. Also, our water service line replacement, lead service line replacement, we're coming to a close. Many litigation pieces, many things that we have going. In order to be able to get your water line replaced, you need to sign up. We need to continue to make sure that we move in that direction because we have to close out the program at some point in time for replacing the lead service lines to your homes. We don't want to miss anyone, so that's why we provided a level of an extension many times. And so we're coming to a close at the end of this month, and we need you to be able to call in to sign up for that, and then we can go about restoring, providing a level of restoration for your property. I know it's been a little bit slower, but we're still been challenged with some things internally as it relates to our government trying to move forward, but we're getting there. We're going to continue to move there. I will continue to push the level of partnership, but you can call 410-1133, 410-1133 to be able to get your lead service line replaced if you have not. If you have already called and you put yourself on a list before and nobody has contacted you back, and the transition, it was a level of making sure that the cross-pollination of information didn't always make it to the from point A to point B, and so we want to make sure we do a thorough review of where we are with our lead service line replacement. But we need you to sign up, and then we also will get the restoration pieces, and we will also start having town hall meetings in a week or so about what we're going to do with our American Rescue Plan dollars, and we will have your input. You won't be left out, and I can guarantee you this, and usually you don't hear people in elected capacities give any particular guarantees, but I'm going to guarantee you this, that we will safeguard those dollars. We will make sure those dollars, from every dollar, from every penny, that it will make it to the benefit of residents. It will be no pinching of those dollars, and you have a great guard for those dollars. No longer will we allow them to pick the pockets of the poor to be able to use those dollars in other ways. Those dollars, I guarantee, will make it to the full access of the benefit of the public. And so that is my commitment. That is my promise to you, that I will guard those dollars to make it sure that it gets to the full benefit of families in this community, no doubt about it. And so to all those who are out there listening, let's be of like thinking, and let's service this whole community as a community. And so with that, we're going to come to a close, and always, I love you, Mom. And I might want to throw the state rep in there too, what happens to be my bride, which is doing a fantastic job. Stay tuned for more with the Messiah Law. No longer should people be victims, especially children, to drive-by shootings or unoccupied dwellings where children are harmed. Messiah was a 3-year-old toddler that was shot in the back of the head as his home was riddled with 67 bullets for an intended target that was not even there. So a new law, bipartisan law, is working its way through Lansing with Democrats, Republicans, parents all alike, saying that we're going to stop this level of violence and this deadly cycle that definitely impacts our greatest asset, and our greatest asset is our children. We invest in them, and we want to make sure that they have something to inherit, but we definitely want to make sure we protect them, and that Messiah's Law, as it works its way through the state government to become law, will help protect those families. And so thank you, Republican State Rep Graham Filler, also Cynthia Neely, the Democrat, that's leading that bill package going through Messiah's Law. With that, we'll have more on the town hall meetings, and also more with the crime suppression inside the city of Flint. If you see something, say something.